a hearing health evolution. Can you all see, first of all, the chart on my screen? Here we go. Human hearing is 20,000 hertz is absolutely the top, but basically humans hear comfortably between 7 and 12,000 hertz. That's cycles per second. And let's move to horses. Horses hear a third more than humans. And then we go to canine hearing is more than twice as much as human hearing, and feline hearing 3 times more than humans. And I like to start off with this because it says everything, the chart. So this is the cap of our hearing, and the whole sensory perception of dogs, cats, and horses is beyond our hearing, and it is greater than our hearing. And that's why it is such an important part of behavior. Sound comes before behavior. So 1 in 2 pets show hearing loss once they're tested. Basically, 79% of veterinary clinics have no tool or have never thought about having a tool for hearing tests besides clapping, jingling keys, or dropping a clipboard, especially address puppy and kitten hearing and senior wellness exams. So I'm going to go right into the hearing test. I had heard about a dog named Archer who was 7 years old, a border collie. He was referred to 2 trainers and a behaviorist for progressive noncompliance and increased reactivity. Over the several months, he was not responding to familiar commands. He became startled when approached, and he became reactive on the streets, on walks. They ruled out pain. A behaviorist friend of mine called me in after a lot of frustrating months went by and said, "Could you do the hearing test? Let's just see what's going on." And sure enough, Archer had lost his frequency hearing range of high frequency and mid frequency and only now had low frequency for whatever reason. It could have been genetic, it could have been exposure to high volume levels over a long period of time. But instead of it being a behavioral issue, it now became a physiological data fact about Archer, and the whole approach now changed for the clinical evaluation. And this may be happening in your work and where you may be not getting a grip on exactly what's going on. It may just be hearing. And so the hearing tool is going to be available to you now. It is free to download on Apple and Google, and it's called Pet Acoustics Plus.
Do you advise that when these tests are being done, kind of all the conditions that you're doing them in? So it's probably whilst you're in a quiet room while the
In a
dog
quiet
or the
room.
cat is relaxed, or that
Yes,
kind of thing. Yeah, yeah,
exactly.
yeah.
One pet at a time and
Yes,
in a
yeah,
quiet room.
yeah,
Yes, in
yeah,
a quiet
yeah,
room.
yeah, yeah.
A lot of veterinarians use the sound therapy first for a few minutes. Veterinarians will have the sound therapy playing in a pocket,
Oh,
maybe in their lab coat or in their pocket. And I was going to suggest that to your colleagues that are behaviorists, to be able to walk into a client's home or have them come into your office, to have sound therapy of this quality playing is an amazing experience to see them, because sound comes before behavior. They will key into the sound rather than feeling more anxious about the immediate environment or the people that are in the room. They will key into the sound. And I want to share with you my music has been proven through biometrics. And I have many studies on my website that have been published and peer reviewed, HRV and activity level, as well as temperature and various others. But those are the 3 main for professionals to recommend to pet parents to have their have the sound therapy playing in the home, in near the carrier, in the car, so that by the time, the cortisol uh, behavior of the cat that's going to have high peaks just getting into the carrier because many pet parents can't even get their cat there. So by the time it gets to the vet exam, and if the vet is playing the feline music in the room or on their body on an app, you're now addressing the hearing of the cat so that it is not using the trigger of the metal exam table, the sound, the high emotion of the lobby, the smells, and it's just that for an animal,
It's part of that whole process, isn't it? Because
it's
there's
part of the whole
so
process.
many triggers. Yeah, and that the same in here in the UK with this big movement, particularly for cats, because yeah, cats are very poorly represented in terms of kind of the medical care because it's stressful to get the cat to the vet. So yeah,
Yeah, the
yeah,
medicalization gap.
yeah.
And I am helping close that because one, to be able to add a hearing test in an exam that takes, you saw how quickly I went through
Mm,
it.
mm,
Once you get facile with it, it's 2 minutes,
mm,
and you get the results in an email is so important for pet parents to know. And it becomes also a billable addition to your practice, no matter if it's behaviorist or veterinary clinic. And I'm very excited to present to you because I think that is going to be a wonderful circle
mm,
of helping this gap close. Where to use the hearing test and the sound therapy. You can start today. Playing in the waiting room and exam room reduces pre-exam cortisol and improves compliance. As a behavior consultant, using in an environment adjunct during desensitization and counter conditioning work. Definitely for any your own home pets for thunderstorm, fireworks, Guy Fawkes Day. Separation anxiety, silence is not a good environment for to leave a dog or a cat in because they are spending their whole day in hypervigilance. So having the sound therapy is a great way to modify behavior and have them feel safe and connected and lower cortisol levels. Post-surgery and kennel recovery, everything that I do addresses the nervous system. That's what um, the sound therapy is for, because quite simply, in the inner ear, where volume and sound and frequencies occur in the ear, that becomes pressure on the eardrum. And that's what triggers the brain for fight or flight. For any kind of travel, the therapy is a wonderful way to reduce motion-related stress. So screen, profile, treat, and track. So 3 things that you can do before your next client appointment. You can download the Pet Acoustics app, which is free, play the sound therapy, and you can recommend it to have it playing, the sound therapy playing before you do any hearing testing for your client.
Hello, I'm mainly feline, but can you tell me, does it matter how loud you play it?
Yes. So let's think about that original chart. Um, that original chart. Okay, so a cat hears 3 times more than we do. So the judgment is as to how loud to play it should be according to that sensitivity level. So the most important thing is to not be human-centric about how to use sound. Because of this understanding of how much more they hear in terms of frequency, and so I'm going to share with you a really great tool. Dogs and cats hear the most comfortably volume-wise, Amanda, between 50 and 80 decibels. You will be able to walk into any room environment and make sure that the volume level of the music and also the sounds are not beyond 80 decibels. That will take the guesswork out of how loud it should be.
Yeah,
When
and I suppose we're not talking about just to put in there, and I'm sure everybody realizes that we're not talking about using that for desensitization, counter conditioning, because obviously if it's something that an animal is fearful of, we're not going to use that decibel monitor for starting a sound off if we're using it for a sound that we're specifically using for desensitization and counter conditioning. What we're talking about is for music that animal hasn't got a fearful association with. So yes, just kind of putting that in there.
Thank you. Thank you, Caroline. And also, again, observation. They don't need, because a cat doesn't need to have a lot of volume to hear and to feel the music.
And that's really important, I think, for us as behaviourists, that when we are starting helping clients with, with plain sounds of things that a dog or a cat or whatever species we're talking about, we're using sound as in the to desensitize against a specific sound that they already have a fear of. I think it's often the case that clients, unless we talk to the clients very, very carefully and support them, they often will start with the volume far too high because it's human centric. We're thinking about a low volume for us, not for the animal. And what's really, you've made clear with just this slide alone, how much we differ, and we should be really thinking about that, and particularly making our clients understand that.
And because we don't make animals calm down, they have to calm down. We have to facilitate it. The sound therapy facilitates that. And for a rescue dog or a dog with reactivity, if they've never, I always use the scale from 1 to 10. If they're a 7, 8, 9, 10 all the time, they've never learned 1, 2, 3, 4. And so by giving them a kind of an oral experience where they can feel, oh, okay, I can relax here. You're helping them will improve because they're now starting from a greater state of calm instead of that red zone. And I'm speaking from, I've been doing this 25 years. So, and again, the studies show it. The studies show it.
That's brilliant. Thank you. Can the app assess for dogs with any animal, I suppose, but dogs with hypersensitive hearing, or is it specifically for hearing loss?
The hearing app gives you a baseline. And so this is a longitudinal experience. If the dog has hypersensitivity to sound, there's a reason why. And it's not just biological.
I would say that the app would be part of the tool for assessing a dog with hypersensitive hearing, because you're assessing the dog as a whole, aren't you? So hearing what they're actually hearing and what frequencies, it is part of your assessment, but it's all.
Yes.
So I would say it probably would help as part of an assessment, because then you could rule in. It's a bit like a medical assessment, isn't it? You're ruling in and you're ruling out certain things. So if your dog is particularly reacting to certain frequencies, then that kind of helps you that dog is hypersensitive to those kinds of sounds within that frequency.
Exactly.
I don't know what anybody else wants to come in on that. I mean, it could be cats as well. So although we've got cat people, it doesn't matter. The species, would it help? I think it would help species with hypersensitive hearing.
I also wanted to mention that in a home environment, there are sounds that we're not hearing that the dog is hearing.
Yeah, yes.
The whine of the refrigerator, computers have sound, the vacuum cleaner. I mean, there's a million higher frequencies that we do not hear.
Yeah, yeah.
And
Does that
so it's
kind of
an
answer the
interesting, it's an
question? It's a good
interesting,
question. Yeah, I think it's one of those. I mean, does that make sense to you, Becca? Kind of thinking about it.
Yeah, that does make sense. It was just really because quite commonly I see animals in consults, and the owners will ask me about the hearing, and I'm honestly I didn't even know this existed, so it's really helpful to know that it's sort of a tool that's available. But yeah, a lot of the time I see a lot of dogs that are really overly sensitive to certain sounds, and particularly to sort of louder sounds, which I suppose some of them could be lower frequency, some of them could be higher. But it was just kind of, you mentioned a lot about hearing loss, but it was whether that would be a useful tool for those dogs that are a little bit more sensitive to other sounds.
if it is hearing loss, it could be a startle response, and it's just from hearing loss. You'll start to be able to assess in more fine detail your clients by knowing exactly how they hear. And again, it's longitudinal, so you'll be able to, the app tracks when you've done the test. And when you do the next time, it'll also show up the date. So you'll be able to follow along. Thank you for a great question.
Tracy's asking a question. It's specific. Her dog has no tympanic membrane, but in both ears. I think you've recently had that diagnosed in your dog, I think, Tracy. But anyway, she's hypersensitive to certain sounds, and the app might help me identify what range of decibels she most reacts to. So I can start to relate it to real situations.
That's fantastic. That
Yeah.
is a couple of quotes from from a behaviorist. If I can just read it quickly.
Yeah, please do.
This is from Marcus Reed, is a certified applied animal behaviorist. Wrote to me, sound therapy changed how I think about the waiting room environment entirely. I used to walk into a clinic and see a dog trembling in the corner and think, separation anxiety, poor socialization, fearful temperament. Now I think, what is this animal hearing that I am not? Since we started playing the pet acoustics in the exam environment, I am seeing dogs settle within minutes. The physiological shift is real and it is fast. This is not background music, it is clinical.
I've loved this. This is amazing. Going to use it with my cat Dinky. I leave the radio on on volume 1 when I go to work. I can't even hear it, but I presume she can. But she's going to have something new to listen to. But what I want to sort of ask is, one of the rescues I'm linked to work in Afghanistan and Nowzad, and the Ukraine, and I don't know how I could sort of get this to them because of the environments that they're in. Have you got any tips? Because they're obviously, one's in a war zone, one was a war zone, and a lot of stressed out animals coming off the streets that have never known any kind of kindness or sanctuary. I'd love to take this the lady I'm connected with, but I don't know how I could help them with it.
The app is available in Afghanistan and the Ukraine, I'm pretty sure. Yeah, you should check if that's the case. And the app is that's the way to do it. That's why I moved from if it's available. And I so appreciate your work.
I mean, I definitely think, from a veterinary nurse point of view, and I know there's some veterinary nurses and vet teams here tonight, that was always historically the way that you would assess sound would be really rudimentary, just clapping or, dropping something. So it is the first time I've heard of something that is scientifically based, but also is able to tell us and pinpoint what that animal is hearing. And I'm so interested in cognitive decline. And you mentioned about human hearing, and there's lots of papers in the human field, talking about how deficits in hearing affects the experience of that older person, but we
Yeah.
also believe the same to be true for our animals. So when our animals age, we can, knowing what they can and can't hear can really inform us to provide a better environment for them. Well, thank you so much, Janet, for sharing this pioneering work that you've been doing and you've brought to us. I'll be letting everybody know how I get on with the programme that you talked about, because I'm excited to start that. Claire has come in. What a fantastic tool. I have a 2-year-old deaf cat diagnosed as congenital hearing loss through the clap and throw instruments on the floor method. But on occasion, his behavioural responses suggest that he has some level of hearing. So I'll be using the test tonight. I also have a client who I think will really benefit from the species-specific music therapy. Thank you for a really informative and inspirational session, Janet. And I think you've said it exactly what I would be saying. Very inspirational. Definitely a tool that we can use on our own animals, but also be kind of shouting it from the parapets to our vets and for our clients. So yeah,
Thank you
you
so much.